Thank you everyone for joining us this morning. We have quite a few updates. First, I'm going to talk about the breaking news this morning. CDC and the FDA have placed a hold on Johnson & Johnson vaccine distribution. There have been 6.8 million Johnson & Johnson doses administered. 6 individuals appear to have developed blood clots within 3 weeks of receiving the Johnson & Johnson. It's not clear whether the cases are connected to it, and it appears to be very rare. CDC and Department of Health will be convening immunization panels at the federal level and the state level to assess risk this week, and we'll monitor the situation and should know more later this week. While this appears to be very rare, less than 1 in a million, if you have received the Johnson & Johnson vaccine, if you experience severe headaches, abdominal pain, leg pain, or shortness of breath within 3 weeks after vaccination, please contact your local health care provider. General updates, we are staying in phase 3 as per the Department of Health and the Governor's Office. Currently, we are seeing a slight increase in COVID-19 cases. We are at about 210.6 per 100,000. As of Friday, April 9th, the Town Toyota Center has administered about 43,583 vaccines. 4,220 were administered last week. 1,800 were second doses, 714 were part of our equity clinic, and 1,705 from our public clinic. So we're seeing still pretty good uptake, which is really positive, and we look forward to opening up more. As of this coming Thursday, everyone 16 years and older will be eligible for the COVID-19 vaccine. Anyone in a previous vaccine phase who's not received a vaccine will continue to be eligible, and if they can contact us, we can prioritize them for a vaccine as well if they're in a high-risk group. In addition, if you are 16 or 17 years old, just a reminder, Pfizer vaccine is the only one that is approved for that age group, and it'll be important to get parental consent. A consent form will be needed to come to the Town Toyota Center, 16 to 17 years old. In addition, it'll be good to have a parent or guardian there as well, just for good measure. And then wanted to quickly say thank you again to our community partners, National Guard and Department of Health. Follow us on Facebook and Twitter at Chelan-Douglas HD for updates, and keep up the 4 Ws. Help us stop the spread of COVID-19. Now more than ever, wear a mask, wash your hands, watch your distance, and sign up for Washington Notify. We just squeaked under the bar for staying in phase 3, so it's really important that we bring down our case rates so that we can continue staying in phase 3.
What does the halt in the J&J vaccine mean for Chelan and Douglas counties?
Currently, we have 3 providers and several pharmacies who have been providing Johnson & Johnson, and right now we're asking them to stop. And we have additional Moderna that Chelan-Douglas Health District has received, and we'll be connecting with those providers to provide Moderna for those who had already scheduled this week. So it'll mean a little bit more logistics, but we should still be able to get people covered who have signed up.
We have reports now that the California variant is in Grant County. The what's called the dangerous variant, or that B117 variant, now is more prevalent in the community. And there's also that a recent report, I don't know if you saw it, that the South African variant might break through the Pfizer vaccine in this very small report out of Israel. I guess just in an all-encompassing way, how is our race against these variants doing? Which one is the biggest concern, and how are we looking with these variants?
So specifically last week, based off of Department of Health surveillance, we see that about 35% of the variants are B117, and approximately 25 to 30% of are also the variants from California. And then the rest of them are other variants in the area. Specifically about the South African variant, Israel has gotten a lot more coverage with Pfizer. They primarily just did Pfizer. And based off of efficacy, we do expect some breakthrough. And so it'll be really important for the CDC and the DOH to look at the data coming out of Israel for them to make recommendations. One of the other things about the variants is that depending on how transmissible they are, they compete with each other. And right now in the state, we're forecasting that the B117 variant is the most transmissible. And if it becomes the dominant strain, we know our vaccines work against it. And Chelan-Douglas Health District specifically has one of the highest rates of vaccine coverage, and we want to keep it that way. So we're asking that everybody on Thursday come in and try to register to get vaccinated so that we can keep our coverage to get that herd immunity to protect against the current variants we have here. And we know that masks work as well. And so, in terms of the different breakthroughs and that kind of stuff, it's really important for us to make sure that we have masking as an option to mitigate cases.
Oscar Rodriguez, One Angie World. Is there a ballpark figure about the number of Johnson & Johnson vaccines that were administered in the Chelan-Douglas counties, or maybe that you guys received at the very least?
We have information on the state allocation, but the federal allocation is a little, we have less eyes on it. We know that some of the pharmacies got it as well, but we're estimating somewhere between about 1,000 to 1,500 Johnson & Johnson were delivered in the area. And we want to stress that this potential adverse event is very, very rare, and that it's important for people to be aware of it, but they shouldn't be worried or scared. All of the news we've heard from our different partners who've been providing Johnson & Johnson have shown that it has been very successful, and there's been very limited adverse events so far. And we'll have more information on the national picture in the coming weeks.
With the vaccine, the Moderna and the Pfizer, if someone receives their vaccine here and then they end up being somewhere else out of town, out of the area, can they get the vaccine elsewhere if they present their vaccination card?
Yes, and that's why it's really important to keep the vaccination card and make sure that wherever they go, they're going to get prioritized for a booster, at least in Washington State.
I just want to follow up on my last question. It sounds like the health district is already in communication with the partners that have been administering the Johnson & Johnson vaccine, specifically CBCH, which has been doing a lot of work with the farm worker community. So it sounds like there's already been some monitoring, occurring to make sure that people, farm workers specifically, they're making sure that they're not experiencing any of these side effects, regardless of how rare they may be.
So at the vaccination points, we require that you have emergency services available in case there are type of events. Partially what we're seeing with the Johnson & Johnson is specific to the 3 weeks after, and none of our providers have had anyone come in with any type of symptom related to that.
So with the surge in people that will have that eligibility later on this week, one, is this expected now these next few weeks to be the biggest surge that we'll see in the area in terms of numbers of people trying to get vaccinated? And doses aside, when that occurs, what's our capacity per day here, and what is our theoretical max capacity for the mass vaccination site?
We hope so. We're hoping the demand is still very, very high. With all of the different phasing that's gone on, some people have gotten it at different points, but we have now about 50,000 people who have not initiated vaccine who are eligible that we're hoping come in. We know not everybody is going to come in right away, and we still have limited vaccine supply. And especially now that Johnson & Johnson is on hold, we're really limited on how much vaccine we are getting into our area. Total capacity of all partners and the mass vaccination site is approximately about 12,500, at 12,500 for a week. With extra personal support and that kind of stuff, we could bump that up to approximately 17,500 a week. But we know in the next 3 to 4 weeks we won't be getting that much vaccine. Without the Johnson & Johnson, we're forecasting approximately about 9,000 doses a week. With the newly eligible population, and if we forecast that out, we're looking at potentially about 8 to 9 weeks in order to get to that 70% mark, to get 50,000 doses in arms. And so we're hoping that we get another 25,000 people in, but it depends on vaccine uptake.
Just a clarifying question on that. So it's with the 3 to 4 week forecast currently that you guys have in mind, we should maybe expect 8 to 9 weeks for the 70% coverage.
That's correct. And that provides a little bit of extra time for people to come in. So maybe they're eligible, but for whatever scheduling reasons, or they're gone, that allows us some time to get people in to get them vaccinated.
When we were talking before, Luke, to use a football analogy, we were talking about kind of the ball being on the 2-yard line and we needed one good push to push it over. Where are we now? Have we moved back a little bit? Are we at the 4-yard or 5-yard line? Where are we? How do you characterize it now?
So we're at about halftime, and so we've got about 50,000 to go, but we're looking just to be able to keep our lead through the third quarter. Then in the fall, in the late summer and fall, when teenagers and preteens and tweens are eligible, we will be ramping up vaccinations for them as well. And one note about the variants, the Moderna and Pfizer technology, the messenger RNA technology, rapid development of boosters is possible. And I can't stress enough how incredibly quick that these companies are able to produce a viable vaccine of high efficacy. And just as an example, within about 48 hours to 1 week of the genome sequence for the wild-type Wuhan virus, Moderna and Pfizer both had viable vaccines that they were able to start launching into development. And so, we're in the public health realm, while we are very concerned about the variants and we really want to use all the modalities, we're also very encouraged by the fact that we know we can have tools available to us much sooner than ever before in human history.
Another question on the forecast. Was it the number of vaccine being allocated in the next couple of weeks, was that less than you guys expected? And if so, why perhaps is the number down?
A large part of that is due to the Johnson & Johnson hold. And while Pfizer and Moderna have been increasing their production, it has been kind of a slow ramp up. As more becomes available, hopefully, those numbers will change as we forecast out into the future. But to plan conservatively, even if we keep the current rate that we have, we'll be able to reach our 70% target by 8 to 9 weeks. And we'd love to be able to get more. We'd love to hit 80, 90%, especially with B117 as it's in the area. But at this point, we're going to work until we have no more demand left, and then we'll be working on education throughout the summer.
She wants to know how the health district feels about this younger generation that is going to get vaccinated, and that this group is the millennials, and they want to be social, and they want to travel, and they want to go everywhere and be with people. Is this a good vaccine for them too?
The Pfizer vaccine is incredibly effective from what we've seen, and the Moderna as well. And so for millennials, for all ages, yes, this is a good vaccine for them to get. So as I pull out my crystal ball and look into the future, we're anticipating that, we just had a lot of people travel for spring break and spend time with families and that kind of stuff. And usually after those types of events, we see a slight spike. And specifically since a lot of they're younger people who are doing it and they're not vaccinated yet or not eligible, we're seeing that in the future. But as we open up more vaccine to that 16 plus population, we know that it interrupts transmission. So our hope is that as we see, 10,000, 15,000 more people at least initiated on vaccine, that'll help interrupt transmission. And we are seeing that our hospitalizations are down, and they do have little spikes, but mostly the severe cases are significantly reduced. But we are still asking people to use caution, to wear masks, and to kind of restrict their movement as much so we can try to fight some of these variants and see less of the breakthrough. Well, thank you, everyone, and we'll probably see you guys again in probably about 2 weeks.